India, as I like to think of it, and I always say that it's not a country, it's like a continent. You have to think of it like a continent. People are not aware about a lot of issues in health until and unless it affects them directly. We talk about young people, but young people are dealing with a whole host of health issues in the country. Even now, I would say that the awareness also about how to read a label, what is written on that label, what does that actually mean? I think that is still very low. Tell people to consume healthy foods, but are they that accessible? Are they that affordable? And are they that tasty? We now have a significant number of elderly in our country as well, and that number is only going up. And a lot of the elderly are also women. Our ASHA workers are so overburdened. We expect them to do everything, and we pay them hardly anything, and we don't even give them any incentives. India has perhaps the highest suicide rate in the world in the younger age groups. Just even having an access to a psychiatrist, psychologist for the majority of the country's population is still a challenge. The kind of cancer I have is a rare lung cancer, and I've been a non-smoker. I was diagnosed when I was just 35, and probably a big culprit in this could be the air pollution. But what will surprise you is that lung cancer in women is now becoming one of the biggest killers. A lot of people will say that I will spend on my son, but I'm not going to spend so much money on my daughter. So it's a harsh truth, but that's how it is. So a lot of women end up dying, disproportionately because of lung cancer for these reasons.
Thanks a lot, Urvashi, for joining us. And let me first start and ask you that you've studied life sciences and you've been part of biosciences enterprises. What led to the shift into healthcare, health sector, and public policy making?
Yeah, I think it's a fairly natural field to be working in, because life sciences, ultimately the goal is to apply it in healthcare. Whether it is new medications or vaccines or whatever it is, medical devices. So I always wanted to be in an applied area rather than in a more research oriented kind of role. So that is why for me healthcare and public health more so, where we have huge gaps, especially in India, where there is a lot of inequities. So it became a very obvious sector for me to then venture into.
Right. So you've also worked as director at the NITI Aayog.
Yes.
Could you talk about that phase of your work life? I mean, what are the projects you worked on, and how did it impact people?
Yeah, I mean, NITI Aayog, for those who are not well versed with it, it's a think tank of the government.
Which was formerly known as Planning Commission.
Right. And it is different from the Planning Commission in the sense that the fund allocation role that the Planning Commission used to play to states, etc., is not there now. It functions predominantly as a think tank. And so therefore the idea is to channel the best of outside research inputs into policy making, and also of course to build networks with stakeholders outside the government. So I joined pretty much towards the start of the organization's establishment, which was in 2016. And I've been the only professional there who served all the 3 vice chairpersons. And of course worked a lot with the member health.
Right.
Because of my area of focus, and also the CEO. So I worked on a whole range of things because I was there for 8 years, which is a very long time. And so I ended up working on everything from medical education reforms to the COVID response, engagement with pharma and medtech, and also a lot of other initiatives such as monitoring and evaluation. I was with the Monitoring and Evaluation Office for about 1.5 years. So that was there. And then, of course, I've also worked on other aspects like the G20. So I worked on a host of initiatives there. and also got the opportunity to contribute to India's voluntary national review on the Sustainable Development Goals. So a lot of initiatives really at the national, subnational, and also then international forums.
So now, since you've pointed out and you've worked at the NITI Aayog for so many years, and you've done extensive work, let's come to say inequality vis-a-vis availability of medical healthcare for people in India. How do you see that? I mean, what are the challenges that the Indian people face vis-a-vis availability of healthcare facilities?
I mean, the challenges are enormous because obviously in a country like India, where there is so much scale, there is so much diversity, every state, every district within that state can be quite unique in terms of its context, its challenges. So that obviously adds to the complexity that we face, because India, as I like to think of it, and I always say that it's not a country, it's like a continent. You have to think of it like a continent. And so the challenges are therefore enormous in terms of access to healthcare, in terms of quality, in terms of affordability, and also awareness. People are not aware about a lot of issues in health until and unless it affects them directly, which is when they kind of, wake up to the importance of healthcare. But until then, it's something which is largely ignored or taken for granted. So I think it's both a demand and a supply side issue if we look at it. And I would say that it's also an economic issue, because we talk about India, we talk about the demographic dividend, we talk about young people, but young people are dealing with a whole host of health issues in the country. And on the other hand, we're also now seeing aging happening, especially in the southern states, and that's going to catch up with the rest of the country as well. So when you have so many of these demographic transitions, you have other global factors like climate change, healthcare becomes even more complex. You have pandemics, we've just gotten out of one, and we never know when another one could be just around the corner. So I think it's a very, very complicated space for such a large country.
So two questions from this. First, let me ask the first question. You've talked about young people and cropping up of so many new diseases. We're seeing rise of obesity, cardiovascular diseases, hypertension, diabetes among young people. Are we taking any concrete steps in that direction? I mean, what are the basic causes of it, and what are the steps being taken to address it?
Yeah, obesity is becoming a big issue, and it is sort of, a challenge for us in a way that we're still grappling with undernutrition on the one side, and then we're grappling with overweight and obesity on the other side. And clearly it's a big issue. We've recently had the Prime Minister sort of launch a social media campaign through public figures to try and create awareness about this. But again, it's a very complex intersectoral issue. It's not just the problem of the health sector, but equally of education, equally of agriculture, the way we grow our food, the way we process it, and industry, of course, because now we have so much packaged foods that are easily available, and the labeling, the marketing, all of that. And then, of course, our lifestyles, sedentary lifestyles, lack of exercise, lack of proper sleep. So I think it's a whole gamut of factors which is leading to that. We are starting to take some steps as far as I see the policy domain, in terms of, even acknowledging that's a big problem, and we need to have initiatives to tackle it. But I think because of its very multi-sectoral nature, it will need much more than just government efforts. It will need various other stakeholders to come together and to again address both demand and supply side, because demand, like I said, a lot of junk foods are much easier to access. They are also much cheaper to access than if you wanted to access fruits and vegetables, for instance. So there's more demand.
Right, so I would like to give an example. A child is going with parents in the mall, and he or she starts crying, and parents hand him or her over a packet of chips or a chocolate to basically say, stop it now. And the child stops. Do you think these kind of things are also increasing because there's no awareness about what food we are eating, what the child should eat, what the child should not eat?
Absolutely. And packaged foods, even now, I would say that the awareness also about how to read a label, what is written on that label, what does that actually mean? I think that is still very low. And of course, on the other side, all foods might not have that transparent kind of labeling, very truthful labeling. So again, it's on both sides of the spectrum that the issue is there, that we tell people to consume healthy foods, but are they that accessible, are they that affordable, and are they that tasty, right? Ultimately, if you're talking of children, taste is a big factor.
Right.
If I want to eat a vegetable, it's not so tasty for me, right? But if you give me this nice chocolate bar or something, it's far more tasty. So that's also a battle to be fought, that
Right.
food can be healthy, nutritious, and tasty.
Right. And also, I mean, create awareness education programs around it where not just the child but the parents also learn it, say from educational institutions or through social media campaigns, that how should they look at these things.
Yes.
Right. So I mean, that would bring me to my other question, that okay, the problem of food is one, what to eat, what not to eat, and labeling and all those issues are there. Do we have any such example from all over the world where such steps have been taken and there has been a concrete difference in outcome?
Yeah, a lot of places have, brought in guidelines starting right from their public procurement. Whether we see UK or we even see closer home, Singapore, Malaysia. So, because public procurement is really the first place, right, where you can reach out to large numbers of people and also kind of set the standards for what should be a healthy, nutritious, balanced diet. So now we see a lot of norms in different countries, whether it's in terms of the salt content, the sugar content, refined versus unrefined. All of this is now getting a lot of focus and a lot of attention. And I think apart from that, even in terms of the industry, the kind of labeling standards, the kind of packaging standards that are there internationally, not just the standards, but also the adherence and monitoring of that
Right.
is very important. Because even in India, we have standards, if you look at it that way. But it's very difficult to monitor here, to regulate here with the kind of complexity we have. And so that is really our biggest challenge. It's not enough to say, okay, this is what the salt content should be, or you shouldn't put more sugar in this, or whatever it is. But if you're unable to monitor that, the implementation of that, and most of our food industry, if we see, is still very unorganized, still very scattered. There's small establishments all over the place. You just go on any road trip and you will see so many small establishments on the side of the road that people are eating from. So it's not easy to
Right.
regulate and monitor the implementation of standards in such a setting.
Because if you want to regulate that kind of a eatery, one, you might end up impacting their
Exactly.
economic condition.
Yeah, exactly.
And they might not be in a position to procure a very high standard
Absolutely.
product.
Absolutely.
The other part to it is obviously climate, right? The climate's changing drastically. In a city like Delhi, you have so much pollution outside that, and not just Delhi, I mean other places also. India's a lot of big cities in India are facing pollution, that you can't go out, you can't walk in the public parks. So hence, no exercise.
Absolutely. And that is what a lot of other countries have also tried to address, like China. They've consciously tried to create open spaces in their cities, where you can exercise, where you can cycle, you can basically do outdoor physical activities instead of just sitting indoors. But like you said, for that you need to be able to at least breathe clean air. China had a huge air pollution issue in Beijing, which it tackled. And I think we've still, not been able to do that in most of our cities.
And then, I mean, now I'll go a bit more back. You said two problems: one, young people, and second, aging. How do we address that? Because I mean, healthcare to aging population. is something which we have not been able to actually provide that much, because one, it becomes costlier vis-a-vis insurance premiums.
Yeah.
And the government hospitals are not well equipped right now to take care of that number of people.
Yeah, see, that's what I said, these demographic shifts that we're experiencing make it all the more challenging, because on the one hand, we still have a lot of young people with their own set of issues, but we now have a significant number of elderly in our country as well, and that number is only going up. And a lot of the elderly are also women.
Right.
In fact, when you look at the data, there is this phenomenon which I refer it, in this way, is the feminization of the elderly. Because what happens is that we have many more women who are surviving longer than the men.
Yes.
And so many women have, lost their partners, they are poor, they are living in rural areas, they might not even have enough social security incomes. So we are talking about very heightened vulnerability here. So I think it's not just aging, but also the feminization of that elderly population that we have to tackle.
Right. And in order to tackle that, you need to raise awareness. In your opinion, what role does somebody like an ASHA worker or a midday meal worker play in such a scenario?
I think our ASHA workers are so overburdened. We expect them to do everything, and we pay them hardly anything, and we don't even give them any incentives. So if you actually look at the list of activities that an ASHA worker is supposed to carry out, it's just inhuman. None of us would be able to do it. So I hesitate to add on more and more to just the ASHA worker. And that's why we have, even when I was at NITI Aayog, we pushed for a comprehensive primary healthcare system. And the health and wellness centers, which have been set up under Ayushman Bharat, are actually supposed to do that. Now, of course, implementation is a big gap still. But I think in theory, if we can implement that comprehensive primary healthcare model where ASHAs are there, ANMs are there, but they are part of a broader team of personnel. So the whole burden cannot be just on the ASHA. And we need a public health cadre in every state. That's again something that I've pushed for a lot in all my work. If you look at states, you will only find a medical cadre. You'll only find medical doctors. And awareness creation is not the job of doctors. That is the role of public health professionals.
They don't even have the bandwidth to do it.
They don't. And it's not their skill set, frankly. So we need that kind of a public health cadre also in every state if you are really to be able to create awareness.
So if I ask you, how has India been able to perform vis-a-vis health-related sustainable goals?
So I think we have made progress on some of our legacy issues, if we can call them, like maternal mortality, infant mortality, institutional deliveries in the country have undoubtedly gone up. So we have made progress on that front. Communicable diseases, we have made some amount of progress, though TB still remains a huge issue and a huge unfinished agenda, which has probably got worsened after COVID. So it's become even more complicated. But I think the biggest challenge for India now is the non-communicable diseases, like you said, the heart disease, diabetes, overweight, obesity, I really see as a disease by itself, because it leads to so many other complications. And cancer is becoming a huge issue. Mental health is again, a very, very big problem, and huge morbidity and mortality, that we're getting because of mental health issues and in young people. India has perhaps the highest suicide rate in the world in the younger age groups. So these are things that I think we have a very long way to go in terms of tackling.
But vis-a-vis also say maternal health, what concrete steps need to be taken? And second, mental health is also a stigma issue for people. They are not willing to come out openly and say, okay, I have this issue. Maybe in the bigger cities, yes, but in the rural India, people might not say it.
Yeah, see, mental health, I think we have improved a little bit with respect to the stigma issue. COVID, I think, played a role in that, because people started very openly coming out and saying, I have anxiety, or I'm, suffering from loneliness related issues. So now, of course, certainly in our cities or, many areas, it's become quite okay to say that, I'm seeing a counselor or I'm seeing a therapist. But yes, I think the inequity with respect to that, rural areas, as well as in terms of access to services. You have hardly any, trained psychologists and psychiatrists in the country. So we are also seeing a problem where anyone and everyone is giving mental health advice, which is also very dangerous. So we do need many more qualified personnel as well, apart from addressing the stigma issue. And we need people to understand that, that is like a disorder like any other. And I think that still needs to come. Ability to pick up symptoms and signs in somebody, what is just sadness versus what is depression, and how many people in the health system even have the ability to pick up those kind of signs and symptoms.
And becomes affordable.
Yeah. So that is, of course, a big part of it. But I think just even having an access to a psychiatrist, psychologist for the majority of the country's population is still a challenge.
You pointed out about non-communicable diseases, and you also talked about malnutrition. I mean, these are two paradoxes, right? You have malnutrition, you have obesity also rising. How do we together bring it and make sure that both of these issues get solved?
Yeah, see, malnutrition, the way we look at it is actually three different buckets, and we're tackling all those three. One is undernutrition. One is micronutrient deficiencies, right? Where you might be getting enough food in terms of quantity, but you're not getting the right kind of food. So you don't have the right balance of nutrients. And then the third is overweight, obesity. So broadly speaking, these three, categories, India is dealing with all of them, because we also have a large number of people dealing with things like iron deficiency anemia. You have almost, I think, 50% of India's women,
especially women,
who have, iron deficiency. Iodine, we have become much better because of the iodized salt mandates. But we still have a lot of other micronutrient deficiencies which are rampant in the population. Vitamin D, now there are recently a lot of studies to say that large number of people in the country are actually deficient. So we need to tackle all these three, and therefore it is very difficult because the strategies that you might use might not necessarily be the same for all of them. So I think this is where a very data-driven, targeted approach is needed. You need to go into every district and see what is my problem here.
Right.
Is it undernutrition? Is it micronutrient deficiency? Or is it overweight, obesity? Or is it all or some combination? You can't have a pan-India, one-size-fits-all approach.
Right.
So you need to get that kind of meaningful data.
Also because, vis-a-vis regions, all regions of India practice different food culture.
Absolutely. Right. Absolutely.
So Urvashi, if may I ask you, you've openly talked about your experiences with stage 4 cancer, and you were talking about cancer earlier. How has it influenced how you see health care in India?
Yeah, I think, it's a very unique position to be in, not one that I would necessarily like to be in, but it's very unique in the sense that I'm a public health professional and a policy professional, and I wear a patient hat. And there's, I think, very few people who combine all of that. So obviously it gives a very unique perspective into the health system, into the challenges of a patient. I think with cancer, there's a whole, gamut of issues, right? From the prevention, screening, detection, to treatment, rehabilitation, everything. So, I think obviously I have a lot of insight into that through my own experience as well, because the kind of cancer I have is a rare lung cancer. And, I've been a non-smoker. I was diagnosed when I was just 35. And probably a big culprit in this could be the air pollution. And so, these are very real things. We think that it's not really happening to people, but it is happening to people. And I was at the prime of my career, my life in every way when I was diagnosed with this. So it really gives you a sense of how healthcare can completely turn, somebody's life upside down, and of course push a lot of people into poverty as well. I mean, and not just the poor, by the way, even the middle class. Even people like us find it very difficult to, go through the whole treatment of cancer on the latest drugs, which are prohibitively expensive.
So, if may I ask, I mean, you've studied various subjects, you've studied health policies and health issues very closely. Is there a relationship between these non-communicable diseases and certain types of cancer? I mean, does it promote certain type of cancer? Does it not? So recently, WHO has released a report saying that women living a sedentary lifestyle might be more prone to breast cancer.
Yes. In fact, obesity is, one of the very clear risk factors that we have already good evidence on in terms of increasing your chances. And so therefore, when it comes to cancer, the kind of preventable lifestyle factors, I think for someone like me, the air I was breathing in a way was out of my control, right? If indeed that had a role to play. But there are certain preventable lifestyle factors. So for cancer, we always say that no smoking, of course, that's very clear. Alcohol, if you can avoid, again, a lot of evidence. And overweight, obesity. That is another one, which is a very preventable lifestyle factor for some of us. It's not preventable for everybody, given their circumstances. But for those of us who can prevent it, we should try to. Because it does increase your risk of cancer, and we do have that evidence. So there's very few things, right, where we have very categorical evidence, and overweight, obesity is certainly one of those.
And then there are certain cancers where women are most prone to have, and we have certain vaccines for it. I mean, is there a campaign being launched around it that they should take that before they're diagnosed with something like that?
Yeah, of course, like cervical cancer. Now we also have, more affordable indigenous versions of the vaccine available, which can be given to girls. Ideally, it should be given before, you kind of start or enter into any sexual activity. That's when the vaccine is most effective. So usually it should be given to younger girls. I think it should be expanded to boys also, because HPV causes not just cervical. It can also cause oral cancer and other types of cancer. So I think, if we can vaccinate boys and girls, nothing like it. Breast cancer, of course, there's no vaccine as such, but there's a lot of screening that you can do, right from self-breast exams to, of course, if you have a history of breast cancer, then you do need to, consult an oncologist and get screened pretty early on. But what will surprise you is that lung cancer in women is now becoming one of the biggest killers, because we have got a much better grip on how to even treat or cure somebody of breast cancer or cervical cancer. But lung cancer is actually now becoming one of the biggest killers, and more so in women, disproportionately in women.
And what are the contributing factors for it? I mean, if there are studies around it?
Yeah, so of course in India, we don't have that high quality evidence. Mostly you'll hear anecdotally from doctors. But across the world, this evidence is increasing, and now better evidence is also coming out of India. So of course, pollution is one of the biggest factors, because a lot of the women who are diagnosed are non-smokers, right? Like people like me. So air pollution and other forms of pollution, you have microplastics in your food, your water is contaminated. So if you're living in such a contaminated environment, then no matter how good your personal lifestyle might be, it might be still very difficult for you to counter all of this. So, and I think why a lot of women are disproportionately losing their lives to it, because diagnosis is not easy to make. When it comes to lung cancer in a non-smoker, a young person, there's no screening. We can't go for any screening. And mostly it's confused with TB or pneumonia or something else. Or in my case, interestingly, I had no lung related symptoms. All my symptoms were because my cancer had spread to the liver. So all my symptoms were abdominal symptoms. And so in fact, I was initially misdiagnosed as having stomach cancer and, given 6 months to live. So even to reach my correct diagnosis took a lot of time, effort, expensive tests. Now, how many people can do that? And how many people will do that for a woman in their household? Because I have seen this gendered, kind of access to healthcare also. A lot of people will say that I will spend on my son, but I'm not going to spend so much money on my daughter. So it's a harsh truth, but that's how it is. So a lot of women end up dying, disproportionately because of lung cancer for these reasons.
Interestingly, we have a very this influx of information on all these issues: obesity, cardiovascular diseases, cancer. We have social media amplifying things on day-to-day basis. People are claiming you eat a pill and you lose weight in 15 days. What do you have to say about that?
Yeah, it's a menace. I would say a lot of my time goes in tackling health misinformation, cancer misinformation as well. I think, social media is great if you use it in the right way. It's as simple as most things in life, really. And unfortunately, now we have a lot of people, who are just becoming health influencers, wellness influencers, nutrition influencers. Everybody is throwing advice at you. And I think that's a very dangerous trend, because if you're not qualified to be doing that, or if it's a lived experience, in cancer, I see we have celebrities, and right now I'm on this whole path where I've taken up Sanjay Dutt claiming that he was cured of stage 4 cancer in like 3 months, and various other such claims. So the issue is, even if it's your own lived experience, even if I accept for a moment that yes, that's your experience, it doesn't mean it'll happen with everybody.
Right.
So you need to put a disclaimer, a strong disclaimer, that hey, listen, I got miraculously cured, but that's just my story.
The bigger problem is that you have these things now available at a click of a button. Say you order on Blinkit, you'll get a pill saying it will clean your gut in 15 days, and then I don't know.
You have patches to make you sleep, you have patches to detox you, you have everything. And I think it's very, very, it's a very tricky area to be in, because it's different to be selling a soap or a shampoo or a, something else. Even those are dangerous enough, as we are seeing now. We are seeing that, there's things in toothpaste and detergents that probably we've been using for generations, which we didn't even know what we were using. But especially when it comes to health and nutrition, and if you start recommending things to people and just giving advice online, it's very, very dangerous.
My last question, what role do corporates have in a sector like this? I mean, what should they now own up, take responsibility and play their part? Because as you said, government can't do everything.
Yeah, absolutely. I think, responsibility and self-regulation, because I always say this, India is too large. No matter how brilliant the government might become, it's just almost impossible.
And not just India, I mean globally.
Yeah, but the kind of scale and diversity we have is actually unique to us, So the government might be able to regulate in a Singapore or a Philippines or a Malaysia or a Finland, Sweden, Denmark. I mean, those are tiny, tiny countries, look at us. So it's almost impossible to just expect that the government will keep regulating or the government will keep inspecting or monitoring. So there has to be consciousness and responsibility, that even if we are a packaged foods manufacturer, we at least honestly put on the label, what we are putting in our ingredients. So I think, of course, government should do better. I mean, I've always said that. But I think the industry also has a lot of onus that it needs to take.
And not just that, I mean, the amount of money they have, they can invest in more research, more...
Absolutely. Awareness, research. I think research, we are hugely lagging behind. If I talk about a rare cancer like mine, which is not so rare actually, it's just that we don't diagnose in India, so everything, seems rare. But there's just no cutting edge research happening in the country. The nearest I can go is Singapore. And why should a tiny, population like Singapore have so much going on, and India has just nothing. So I think, of course, government needs to step up. And I've always said this, that our investment in R&D is just way too poor. But so is the private sector's investment in R&D. If you see in other countries, it's very private sector led, the investment in R&D, not so much government led. But that's not the case in India. So we need the private sector, corporates, we need them to step up.
Thanks a lot, Urvashi, for
Thank
giving
you
us
so
your
much.
time.
Thank you.
That was Urvashi Prasad, former director of NITI Aayog on Health Spark. To watch more such interviews, please visit our website and subscribe to our YouTube channel. Thank you.